Join the conversation in Tipperary. Contact us through Facebook, Twitter, or email tiptoday@tipfm.com.
Now, time for our orthopedic consultant, Mr. Stuart Edwards. Good morning to you, Stuart.
Morning, Fran.
Good to talk to you today. We've been inundated with queries for you this morning for some reason. I wonder, is this weather related because it's been so damp and stuff?
I think it probably is, Fran. The joint pains are much more significant in the damp and cold weather.
It's interesting, isn't it? First question, an interesting one. Will you ask Mr. Edwards why an epidural is so expensive? I was quoted €3,000. Otherwise, I was looking at 2 years on a waiting list. I'm crippled with arthritis in discs and spine. We always associate epidural with pregnancy and with labour. But is it a tool that you use, Stuart?
I don't personally use it, no, but I do refer patients on for epidurals. It's particularly useful for patients that have significant back pain with disc bulges, which are pinching the nerves, given sciatica. So it's a nerve blocker or an epidural. And in the private sector, I'm uncertain about the costing that they've stated because I don't do it myself. It might seem a little bit steep, to be honest, but it's a multitude. As the hospital needs to get paid, the anaesthetist, etc., and the drugs that are used. So I'm uncertain regarding the costings. I thought it'd be 1,500 to 2,000 perhaps, but I'm uncertain of the costings, to be honest. But there's a lot of input involved in performing the injections as well, and you need X-ray machines, you need anaesthetics, you need the theatre team, the hospital admission, etc. So there's a lot involved.
Yes, so there is admission into hospital necessary for that. So that's probably what's driving up the price.
As a day case, yeah.
Another listener, Stuart, I'm waiting on a knee replacement. I'm getting steroid injections to try and put it off until I'm older. How many of these can I get before surgery becomes necessity, Suzanne?
Yeah, depends on the age of the patient. Older people have different perspectives of what old is in relation to joint replacement surgery. The one thing I would say is if you're in absolute agony and you've got severe arthritis, you're never too young, relatively speaking. Now, if you're obviously in your 30s and 40s, trying to delay it as long as possible is a good idea. But if you're over 50 or even in your early 60s, don't put it off if you're in agony. As in relation to steroid injection, you can have up to 2 steroid injections per annum, and that should be okay with no issues. The concern about steroid injections in a knee that isn't arthritic or only mildly arthritic is it can progress the arthritis, but if you've got severe arthritis anyway, it's not really going to cause you significantly more issues. So 2 a year, adding in hyaluronic acid, which is like WD-40 for the knee as well, may improve the longevity of the injection. And I certainly do that in my practice, and I have lots and lots of patients that come back for a top-up every 6 months until they're ready.
Why do people put it off thinking that they're too young? Is it about the longevity of the procedure? Is that what's worrying them?
It is, but then you need to speak to your surgeon. I mean, the literature suggests that if you're under the age of 50, then a knee replacement may last you about 10 years because the demand you put upon it is much greater than if you're older. And that does have a bearing in our thought process of whether we should proceed or not proceed. But then what it always boils down to, Fran, is if you're in absolute agony and you can't cope with life, and sometimes we have no choice.
Sure.
You know, I did a knee replacement on a 47-year-old this week because she's got severe arthritis and she's in agony. And as long as you explain to the patients that the longevity of the implant may only be 10 years or so, they have a choice. And we all have choices in life. And it's about getting rid of the pain you have now rather than deferring another 5 years and living in agony, you know?
Yeah, I have all of the usual twinges of age and stuff, but that idea of people living in, as you describe it, agony, I mean, that is so debilitating and awful, isn't it?
Absolutely. And it's very frustrating. And I see it quite a lot. And There are lots of reasons for it. A lot of farmers will struggle and have severe deformities to their limb and just keep on going. But they're quite stoical characters, and they, I'm in disbelief sometimes when I look at the X-ray and look at the deformity, and I can't believe they put it off for so many years. So, as I say to everybody, don't suffer in silence. There's no harm in getting an opinion. You may not need surgery, but get an opinion.
Somebody else says, will you please ask Mr. Edwards what he thinks of PRP injections? I find steroid injections good, but I've been told to try PRP instead. What's PRP, Stuart?
PRP is when you take the blood from a vein, you spin it in a machine, and the serum left has platelets in it and other growth factors and factors that help with inflammation, and they can be injected into joints and they can be injected into tendons. They're very effective with tendon infections. If you inject a steroid into a tendon, sometimes that tendon can rupture. If you inject the PRP, there's no risk of that, and it works very good for inflammation. It's like your own body's natural way of getting rid of inflammation. So PRP injections for tendonitis is very good. Right. In joints, it can help, but the literature is really a bit woolly as to whether it's much more effective than the local anaesthetic and the steroid injection.
Interesting. That's not stem cell now, is it? That's a different...
No.
Okay,
that's different.
That's a completely different thing. Okay.
Yeah.
When I get up in the mornings as a listener, I have a pain in my lumbar area and my right buttock. I'm finding it difficult to walk. After 10 or 12 minutes of stretching, I'm fairly okay for the day. I'm over 80, says Martin.
They're very likely to have some arthritis to the facet joints of the lower part of the lumbar spine, with maybe a little bit of impingement on the nerve that can refer into the bottom, into the buttock. An MRI scan would diagnose that, and sometimes just a simple injection into the lower lumbar spine, into the facet joints around the nerve, a bit like the epidural we spoke about earlier, can be very effective in helping the pain rather than proceeding with major surgery.
All right. James was on to say, what is the treatment for neuropathy in the feet? My feet are burning all day and night. It's just awful, says James.
Yeah, that's not really my area of expertise.
Sure,
It can occur with diabetes. You can get diabetes neuropathy or diabetic neuropathy, where the small vessels around the nerves can cause an issue. It's normally a neurologist would deal with that rather than an orthopedic surgeon. Because we deal with like pinching of the nerves rather than a general nerve issue.
That's interesting. But I presume something like the result of diabetes would run in parallel with some of the work you do, and I'm thinking particularly where the ankles and the feet are concerned. Do you take that into account in how you would treat your area of expertise?
Absolutely. I mean, the thing with diabetes is when you're considering surgery, your risk of infection is slightly higher than in a patient who's non-diabetic. So that does have a bearing. And sometimes because it affects the vessels of the leg, sometimes your vascular tree, we call it, your arteries and your veins, aren't as good as what they might be in a normal person, and that can cause problems as well after surgery. And very rarely you can have such bad diabetes that it can affect you that you don't actually feel the pain in the joints, and you can get a really bad arthritic joint called a Charcot joint. So yeah, absolutely, that has a big bearing in orthopedics.
Tricia was on, says, I have numbness in my tailbone. I fell recently and it's been annoying me ever since. I have bad arthritis in my hips and legs already. Yeah,
it sounds like with the fall, it may have just caused a bit of damage to some of the superficial nerves that can cause that supply the skin around that area rather than any other damage. But an MRI scan would help that and see whether there's any pinch in the nerves that can cause the numbness, or whether it's just a superficial nerve that may have been affected. But if it's just numbness and not pain, that's not too much of an issue. If there's pain as well, then I'd definitely get an MRI to see whether there's any issue with the sacrococcygeal joint of the tailbone.
My partner complains of hip and knee pain constantly. He's 30. All his bones click when he tries to get up from sitting. What about that, Stuart?
Yeah, well, in a 30-year-old, it'd be unusual to have arthritis, but it's not unheard of. I do see it. A lot of patients can have clicky joints, but clicky joints per se doesn't necessarily mean you need to do anything. But this listener has pain as well, so they certainly need to get an MRI or an X-ray of their joints to have a look in detail to see whether there's any damage to the cartilage in the knee, either the meniscus, which is a cartilage between the bone, or to the lining of the bone, just to get a diagnosis and again get an opinion from an orthopedic surgeon, just to see that there's nothing you shouldn't be doing now.
Hilda says, 5 years ago I broke my collarbone. It didn't knit back properly. I'm now suffering with back pain, and I'm wondering, is this related in some way?
I think it's very unlikely because the clavicle, your collarbone, is a far distant away from especially with the lower back. So I think it's very unlikely. I think this just it's a separate issue, and the lower back or the upper back pain is more likely degenerative or wear and tear rather than be in relation to the fractured collarbone.
Would you take a final one for me, Stuart? I have numbness in my thumb and my next finger to the thumb. So what is that? That's the eye finger. Plus pins and needles going down the hand from the elbow. Sharp pain at the back of my shoulder, and just asking for your take on that. Yeah.
There are several causes for that. You can get compression of the nerve either in the neck or at the shoulder or at the elbow or at the wrist. The most common cause for numbness in the thumb and the index finger is something called carpal tunnel syndrome, which is pressure of the nerve at the wrist, at the palm. And we can perform nerve conduction studies where you can use electrodes to determine where the area of compression is. So that would be the first thing to be assessed, do some special tests in the clinic, and then refer on to a neurophysiologist who can determine where the pressure is. And if it's in the neck, then we can deal with that by doing some injections around the nerves in the neck that can help. If it's at the wrist, we can do a carpal tunnel decompression. So it could be, there are many differential diagnoses it could be. So get an assessment and probably have nerve conduction studies.
Stuart, always great to talk to you. Thank you so much for making time this morning.
My pleasure, friend.
Thank you. Good morning to you. That is Orthopedic Consultant at Aut-Even Hospital in Kilkenny, Mr Stuart Edwards, speaking to us there. Lots more coming into us on that, and apologies if we didn't get to your particular query, but we've run out of time because news is on the way at 11.
Tip FM's Tip Today.
With Slattery's Garage, puck on. It's time to change. Test drive the award-winning range of Peugeot hybrids and fully electric vehicles at Slattery's Garage today. See slatterysgarage.ie.